Hey guys, welcome back to my channel. If you are new here, my name is Des and I make lifestyle and beauty videos. Today's video is going to be all about SPD or Symphysis Pubis Dysfunction and PGP or Pelvic Girdle Pain. I'm going to cover the symptoms and the risk factors, and I'm also going to give you guys some tips and tricks and advice at the end of this video if you are struggling with SPD or PGP yourself right now. So I'm going to start out by just letting you guys know a little bit of what's been going on with my personal journey when it comes to SPD and PGP. And I am going to go ahead and just use the acronyms throughout this entire video, so I'm not saying these long, drawn-out names. So I'm now 33, almost 34 weeks pregnant, and I started out having hip pain at around 20 weeks. My hip pain was pretty severe when I first got it. I ended up having to buy a heating pad, and I couldn't sleep on one side for too long at night. I would have to flip sides. Sleeping on my back felt the best, and during pregnancy you're advised not to sleep on your back, and I won't get into all of that, but it was just really frustrating because I just couldn't get comfortable. And then after a few weeks of having hip pain, that just kind of went away. Like, my hip pain just disappeared. And then I started getting this pain right in my pelvic groin area. The best way to describe it is it feels like somebody just went and punched you right in your pelvis. It started out as pretty moderate. It wasn't too bad. It was I could handle the pain. And then it just slowly started getting worse and worse and worse, to the point where there are now times during my day where I have a really hard time walking, standing up, walking upstairs. Just your everyday activities that should not be hard are a little bit more challenging for myself. So that was really frustrating, and I started, obviously doing some research and looking up different things that I could possibly have, or if it was just normal pregnancy symptoms. I did mention it to my doctor, and my doctor just said, no, that's just normal, that's part of pregnancy. My doctor suggested getting a pelvic support band, and I still haven't done that just because I've learned different ways to manage my pain and to get through the day without that. But I still have about 6 weeks to go, so we will see if I end up needing even more assistance, because at that point I will probably invest in a belt. So that is my history with SPD and PGP, and I am more so self-diagnosed. I didn't really bring it up with my doctor after I had talked to her. Once I started doing some research online and just talking to other people that have experienced this, I realized I definitely have it. There's no need in bugging my doctor about it more, because there's really not much that your doctor can do for you other than, offer you advice and different methods and ways of managing it better. I'm going to go right into what SPD and PGP is. So basically, your pelvis is formed from two pubic bones that curve and make a cradle shape. The bones meet at the front of your pelvis, and that area is called your symphysis pubis. During pregnancy, your body releases a natural relaxant hormone to kind of relax and get your body ready for labor. And sometimes your body just releases too much of this hormone, and that causes swelling and pain in the symphysis pubis joint, and that is what results in SPD or symphysis pubis dysfunction. Doctors do classify any type of pelvic pain in pregnancy as pelvic girdle pain or PGP. So you will hear different people say different things when it comes to PGP and SPD. Some people say that if your everyday life is not affected by your pelvic pain, then you don't have SPD, you just have pelvic girdle pain. I'm not necessarily affected when it comes to doing everything I want to do, because I still do everything that I want to do. I just have to do it a little bit differently now. But I would still say that I have SPD because I match every single symptom that is listed anywhere that you look. So there's lots of different types of pelvic pain during pregnancy, but SPD is the most common one out there. I was unable to find any statistics when it comes to PGP, but I've heard that 1 in 5 women will experience pelvic pain during pregnancy. I myself am experiencing mainly just pelvic pain. When I walk, stand, do too much then I will get back pain, lower back pain, and every now and then I get leg cramps and a little bit of hip pain when I'm sleeping at night. A lot of people will say that SPD can only occur in second pregnancies, but this is my first pregnancy, and like I said, I am very confident that I have SPD. So don't let people tell you that you don't have it just because you're in your first pregnancy. It is very possible for you to get SPD in your first pregnancy. So now I'm going to cover the symptoms of SPD, and PGP is just pelvic girdle pain. So if you have pelvic pain, then you can just say, I have pelvic girdle pain, or I have PGP. But these are the symptoms of SPD. And the number one symptom is obviously pain in the pelvic or groin area. So if you experience pain in that area that feels like sharp stabbing, the best way that I can describe it is literally as if somebody punched me, and I said that before already, but it's the best way to describe it. Also, back pain is another symptom. Also, pain at the back of your pelvis or your hips. Another symptom is a clicking or grinding sensation in your pelvis. I do not have this. I have not experienced it, but that is another symptom. Another one that I experience is pain down the inside of your thighs or between your legs. That is where I get all of my pain, really, is on the inside of my left thigh. Another symptom that I experience as well is pain that's made worse by spreading your legs, walking, going up and down stairs, or moving in bed. Spreading my legs sucks. Like when I'm getting in and out of the car, when I'm getting in and out of bed, anything that requires me to spread my legs hurts pretty bad, especially at nighttime. During the day I can usually still spread my legs, like when I'm getting in and out of the car I can still do that fine. I just have to take it a little slower, but in the middle of the night it's about 10 times worse, and there are times when I get up in the middle of the night and I have to have my husband, like, physically get out of bed, come and stand me up and walk me to the bathroom, because that's how bad the pain is. And which leads me into my next symptom, and that is pain that is worse at night. And that is so true. And if you're pregnant right now, then you know that you're getting up to go to the bathroom multiple times a night. It's not just once or twice. It's 3, 4, 5, 6 times a night you're getting up to go to the bathroom. And the way that I have described it to my husband is just that, like, the first time I get up to go to the bathroom isn't too bad. Second time gets worse. It just gets worse and worse every time I try and get up to go to the bathroom. So those are all the symptoms, and like I said, I experienced all but one of those symptoms. So that is why I'm pretty confident that I do have SPD. So next I'm going to cover the causes and the risk factors of SPD. You can have SPD if you have had pelvic or girdle pain in the past, before you were pregnant. You can have it if you had a previous injury to your pelvis, if you had PGP in your last pregnancy or SPD in your last pregnancy. And this is my risk factor, I guess, and that is if you had or have a high BMI or you're overweight before you were pregnant. I am overweight, not severely, but I am overweight enough to obviously cause me to have SPD. And sometimes, guys, you are just unlucky. Sometimes you don't have any of those risk factors. You just end up being one of the unlucky ones, unfortunately. So yeah, SPD can be life debilitating. It can really, really affect your everyday living and the way that you do things. I've known women who have had to be in wheelchairs. I've known women who have had to be on crutches. So I myself feel personally lucky that I don't have to experience all of those things, but I still have to do things differently, and I'm still in pain 80% of my day. So I'm just going to go ahead and cover some treatments and some advice, some tips that I've learned from experiencing PGP and SPD. One of the number one things that I do to help myself is prenatal yoga, and I don't do it as often as I wish that I would, but I found a YouTube channel that is called Sarah Beth Yoga, I believe. I will link it down below, but she's pretty awesome. She has some prenatal yoga on her channel, and I've done it. I can't really do all of the, all of the exercises that she does because of my SPD, but I try to do what I can, and some of the stretches really, really help and just feel so good, especially at the end of a long day. And then also pelvic floor exercises, you can just Google those, and there's a couple different ones that you can do at home. Another one of the things that helped me is not sitting for too long. If I sit down at work for too long, or if I am just in a car for too long, just sitting doing nothing, and then I go and stand up, it's awful. That's when it's the absolute worst, is after I've been sitting or obviously sleeping at night. My advice there would just be to try and stay active throughout the day. If you have a job where you sit a lot like I do, just get up and walk around the office or walk around your work a little bit and go back, sit back down. Every like 10 to 15 minutes, get up and allow yourself to stretch and just get those muscles and joints working and moving so that they don't get too relaxed. Another one that I do is trying to not spread your legs too far when you're, getting in and out of the car, in and out of the bath, in and out of bed, in and out of a chair. Anywhere that you're getting in and out of, trying to just keep your legs together, move them together, and then stand up tends to help me quite a bit. So definitely try that if you're experiencing pain when you're trying to stand up. I think what did help my hip pain was actually sleeping with a pillow between my legs on my side. I have a pregnancy pillow, a U-shaped pillow, and I will put one of the legs in between my legs and sleep on my side. And that's been the best way that I have found to sleep. It's really not that bad as far as sleeping. Once I'm asleep, I'm asleep. Especially if I have that pillow in between my legs, I'll sleep all night. But if I don't have the pillow between my legs, then I'm in quite a bit of pain and I can't sleep. So try that if you haven't already. Another one I do is trying not to lift or push heavy things. I've noticed that if I, try and lift super heavy things or push heavy carts or heavy whatever, just heavy things, then it makes my pain worse. And at that point I will start getting back pain as well. And another one is going for walks. So I try to go for a walk, if not every day, then every other day, just around the block, just to kind of get those muscles, like I said, working and moving, and trying to not let them relax too much to where I'm going to be in a severe amount of pain. But an important thing to remember is do not overdo it. If you are going to exercise or do yoga or go for walks, don't overdo it. Do as much as you can do. Don't overdo it, because I promise you, you will absolutely regret it. And you will just make yourself be in even more pain than you need to. And some advice that I found online, and none of these I have tried, so if you have tried them and they've worked for you, please mention it down in the comments, or if you've tried things that I haven't mentioned. But some other things that, like I said, I found online are water gymnastics or swimming, and I really have wanted to try that. I just haven't gotten around to it. But I feel like that would feel amazing, because hot baths also feel amazing to me. They don't really fix the pain, but they just feel really nice whenever I'm, taking a bath. So I feel like being in the water, swimming, and kind of stretching and moving those joints while you're in the water would be a super easy way to get some exercises in as well. And those are really the only things that I saw mentioned online that I haven't tried. So like I said, guys, if you have tried things that have worked for you, please let me know down in the comments, for myself and also for other women who are struggling with this as well. And waiting between kids, so waiting like at least 3 years, will help you to not have it again in your next pregnancy. And also, if you are overweight like myself, then just getting active and losing some of that excess weight will also help as well. So this is my first baby, and I am planning on definitely losing all of my excess weight and getting in shape after this baby. And also, I am definitely waiting 3 years, because I don't want to experience this again. But yeah, guys, that's all I have for you today. I hope that I helped somebody, or at least I gave somebody some good information. I will link down below where I got all of my information from, and I'm also going to link a website down below. It is a website called Pelvic Partnership, and it is just a website that gives out information, awareness, and just advice on PGP and SPD, and I found that website super helpful. They have different videos and different things for you guys to go on and see and just look at, and hopefully that website will help you as well. But that's all I have for you guys today. I hope you guys enjoyed this video. If you did, please let me know in the comments, and please subscribe to my channel as well. and I will see you in my next video. Bye.